Hello everyone, it's Ravi from the Royal Pharmaceutical Society and I'm back today with one of my daily COVID-19 updates. A few things have happened over the last 24 hours that I thought would be useful to give a whistle-stop update on. Lots of this information is available on the RPS website, so do check it out after this update as well. Yesterday I mentioned that in England, the government and PSNC announced additional support to help with cash flow situations in community pharmacy. A cash injection of £300 million will be taking place, and this is basically a 2-month advance for community pharmacies to help improve immediate cash flow issues. I know that PSNC are continuing to work with the Department of Health and government on additional funding for community pharmacies to reflect the rising costs that are experienced from COVID-19. So we know that hopefully hopefully is a stopgap for those further more detailed discussions to take place and over the coming few days, and hopefully some further progression around additional funding will be made. RPS raised their concerns around this. While it's a step in the right direction, it's not going to produce the solutions that we need. It needed to be new money. Additional money needs to be supporting the sector right now to help deal with the increasing pressures, increasing costs that we know many of you are talking about. So let's see what happens. We'll be continuing to raise this as an issue and continue to raise the pressure around some of these negotiations and discussions on behalf of our members, but also on behalf of the profession. NHS England and Improvement also published a new community pharmacy letter yesterday evening, so do check it out on the RPS website. Those who are RPS members would have received an alert around this information as well. More information is also placed on the NHS England website as well. Key information from that letter, which I thought would be useful to update everyone on. There was advice on key NHS workers. The letter makes it absolutely clear that pharmacists and their support teams are key NHS workers and should receive the benefits associated with being a key NHS worker as well. We continue to ask for this clarification from the NHS and government, and this letter clearly states that as well, which is good to see. There is also some support within this document around the installation of physical barriers within community pharmacy settings. So NHS England and Improvement will be providing a £300 payment to help pharmacies install physical barriers such as screens or retractable tape in order to help with social distancing requirements implementations for pharmacy settings in particular. So again, once again, that letter has that information. There's also information on electronic repeat dispensing and support for it, information on formula and milk, wholesalers and care home services being provided by community pharmacies as well. There's also been further information published by the NHS on volunteering programme and how to access that, not only on how you can become a volunteer, but also how you're able to access the volunteering service across the entirety of the NHS, whether you're working in secondary care, primary care, other parts of the NHS in a patient-facing role. So once again, that information is available on the RPS website for you to engage with. We're still working with government and NHS organisations across England, Scotland and Wales around our policy ask, and it's not stopping. We are having further conversations, seeking further clarification on various points, and we've got some progress to update you on some of them. This morning we've once again chased up the information around COVID-19 testing for frontline pharmacy teams. Government and NHS are aware that this is really key to get this information out there, and they're working with their counterparts internally to try and get that information out to the pharmacy profession as soon as possible. We have raised this for not just pharmacists working in community pharmacy, but those working in general practice, those in hospital, anyone in a patient-facing role and their support teams to be able to gain vital access to COVID-19 testing. This is really important. I think the governments and the NHS really respect that this information is really important. So they're working as hard as they can to get the latest information out to the sector as soon as possible. We've asked for further clarification on PPE information. We feel that the Public Health England guidance or our respected country guidances need updating in particular. We know that guidance is currently in the process of being updated. The RPS has fed into this guidance quite strongly for pharmacy teams across the entirety of the NHS, ensuring parity and ensuring they get the right quality and access to PPE when needed and where appropriate. Indemnity insurance, so we've been calling for state-backed indemnity insurance support for pharmacy teams working across the entirety of the NHS. in their response to COVID-19. The Department of Health is currently working on an FAQ list to help provide that information to the sector. We know that people working in secondary care will be well supported through the state-backed CNST schemes that are already in place, and those working in general practice are generally under state-backed scheme. We hope the coronavirus bill is going to be extended to anyone working in a patient-facing role for any activities relating to COVID-19, but that information should be out quite shortly. We've also called for further abolishments of prescription charges in England during the COVID-19 pandemic. As I may have mentioned yesterday, the government are aware of this call and are working quite hard to try and see what the solutions are around this. So hopefully more information to come. We are also raising issues around medicine supply chain and flexibility around this to enable pharmacists with more autonomy to be able to manage these in their settings rather than going back to the original prescriber. So we know that's on many governments' lists at the moment of things to try and get through in action, so we'll see where that ends up. We're also raising key issues around workload for pharmacy teams. We understand people are under an extreme amount of pressure. The workload continues to increase. I've experienced it myself volunteering, and how this is impacting on people's mental health and well-being, but most importantly, the long-term sustainability of our frontline staff. You know, working at this pace is unsustainable. And I hope that, I do believe that government and the NHS need to recognise this and support pharmacy teams through extra support from a perspective of supporting their mental health and well-being, rest breaks, and being able to give them that flexibility to be able to manage and fight against this COVID-19 pandemic. This is not a sprint, this is a marathon, and having our frontline staff in the fittest shape they can potentially be to help support the public is crucial and vital. Key updates from the RPS, which I thought would be useful to update you guys on. So RPS are currently in the process of developing an ethical framework for all pharmacy teams across the NHS to help with really difficult decisions that may need to be made around COVID-19 in relation to patient care as well. So that should be available very shortly. We're currently working through some draft reiterations, and we'll let you know as soon as that's available to everyone. We've been working with key partners at the moment to develop new clinical guidances around medicines, in particular around clozapine and lithium. That is up on the RPS website. More information, more other clinical related guidance will also be coming up very shortly. We have a webinar taking place tomorrow in infectious control. There's opportunities, it's free for everyone, whether you're a member or not, to register onto it and to receive this valuable information and be able to access it. We're also developing a number of resources and adding new resources to the website. There's been some new resources from NICE being published around rapid guidances and evidence summaries, and the NCHA guidance on delivery changes for clinical and medicines home care services too is also being added to the RPS website. So lastly, again, I just want to say we continue to hear the remarkable work of our frontline teams day in, day out. And I know this doesn't feel like it's getting easier. You know, energy levels are getting lower. Adrenaline is not there as it used to be within the first couple of weeks of our response to this, but you know, I keep going back to this, I keep saying the same thing. You guys are doing an absolutely incredible and phenomenal job on the front line, making the whole profession extremely proud. But the way you guys are supporting the NHS, the government, and most importantly the public, the people that we try and care about within our local communities, is phenomenal and incredible. And it's just really important for us to keep telling you that and recognising the valuable contribution you're making to society and the welfare of our communities. So once again, thank you from everyone here at the RPS, and I shall see you all again tomorrow. Thanks.